Hi, we're Care Catalyst, Team 18. We're revolutionizing healthcare by optimizing the prior authorization process. So what we want to talk about today is the administrative workflow. This is the interaction between the providers and the payers. And this interaction here is costing the US healthcare system $88 billion per year. And the most inefficient part is prior authorization. This lags behind compared to the other steps because in other scenarios, 88% is automated, but prior authorization, only 31% has achieved automation. The reason is because of complex policies creating inefficiencies. First, the provider, we're going to go through this example, checks if the code that they're trying to prescribe requires prior authorization. If they're lucky, no, it doesn't. If they're unlucky, this is the most common case, they have to submit the prior authorization forms to the insurance company. The insurance company will review that, and yay, likely approve it. But if they don't, this becomes a very complicated workflow between the provider and the payer. Now, these inefficiencies are affecting multiple groups, including the insurers, who are spending around $300 million annually on these manual processes, providers, who are spending like 16.4 hours per week completing these prior authorizations, and the patients, who are seeing, in 93% of cases, delays in care and adverse outcomes. Now, the problem here is that the payers' policies control implementation. They'll only pay for what they're going to pay for based on their policies, but the provider is prescribing based on their clinical judgment. They don't know what the payer wants. The reason is there's way too much information out there. There's too many providers, or too many insurance providers, and the healthcare provider is lost. There's this big barrier, and we're going to focus on United Healthcare to illustrate the scale of the problem. United Healthcare, their policy is dealing with 11,163 different CPT codes and greater than 19,000 different drug codes in the US. And for one of those, we pick CT scan as an example, there are 3,119 pages of guidelines. There's just too much information for the provider there. That's where we come in. Care Catalyst, we're collapsing this information away and giving them a direct solution to the problem. We are automating this process of figuring out what the provider needs to do for the payer to pay for whatever they want to prescribe. Our top competitor is this company called Acasa, which already looks into automating prior authorization with large language models and generative AI. However, they are lagging behind us because we are predicting. We are taking the information from the policy and telling the provider what they need to do, because right now their prior auth will not get accepted. This is a market opportunity of $494 million in the US if we are able to capture that whole cost savings. So taking the market size volume of prior auths per year, 280 million, we're assuming a 2% startup market capture. That's 5.6 million transactions per year. Now, we were able to, based around those volume numbers, come up with this pricing model. It's around 11 cents cost per prior auth, and our revenue per prior auth based on past pricing models is around $5.79. That's 32 million in gross profit per year at a 98% margin. There's a huge market opportunity here. And even that pricing model, we were able to validate over the course of this hackathon by looking at the cost of first sourcing the information from Epic using an EHR engine called Redox, then using Azure for storage and processing space, and then using the GPT models to summarize the data and collate it into a response to provide back to the provider, comparing their clinical work with the payer policies. So this is a versatile impact. It goes towards all three major stakeholders. We're reducing time and cost for the insurers. We are reducing hospital stays and frustration on prior authorization for providers, and patients are receiving shorter hospital stays and improved health outcomes. We are a team combining diverse perspectives from data science to medicine. Thank you. This is Care Catalysts.
Hello everyone, this is Madhu and I'm from Stanford University. Thank you for this opportunity here. So we have developed a couple of solutions to this. So the LLM model that we have developed to identify the prior authorization codes and the reach for it is right here. So we are kind of calling it through an API endpoint, and this is some input data that we have generated, and these are the outputs that we got. So this is one of the input text that we have given, and this is the response. So that it says it is acceptable because all the required data is available. But let's see this one. So this instruction map is rejected because of some reason which is mentioned clearly. So yeah, after this, going to the UI part. So we have started implementing some prototype application which details how we can use this product. So right now, let's say I'm trying to get some prior authorization for Alice, and all my documentation is already set. I would go here, and let's see here, there is nothing here in the prediction box. So I just go. The flow has triggered the API to open an endpoint, and it is saying that it is rejected because this particular part is prescribed for minor backache and a couple of other reasons as well. Let's go back and trigger all the admissions at once because all the stuff. So let's remove this. So I'm running this particular flow for all the four. Yeah, I can see like 2 of them are rejected and 2 of them are accepted. Let's open Diamond's account, and for this hospital admission, it is accepted because all the given drugs have been relevant for the patient information and medical history. Yeah, this is something that we wanted to automate. And after this, we can also trigger. So I got an email with the name Diamond.